Risk. A seemingly simple word with many, many different meanings. Different perspectives on risk can lead us to different actions. So it's important for us to know how we make meaning of risk and how different people decide on different meanings. Today I'm going to talk to you about why this matters to us, both as individuals and as a society. So the topic of risk is one near and dear to my heart, in both a professional and personal capacity. People have called me a bit of a risk taker. I've been a skydiver for, well, let's just say many years. To show you how long, these are pictures of my very first parachute on the left, and then my more recent parachute on the right, with my newer parachute, of course, being much more steerable and much more landable and much more pleasant in every way. I have about 1,900 jumps now, and for a long time I was into what they call big way skydiving, which means trying to get a bunch of people together in free fall to build a predetermined formation. I hold 5 world records in big way skydiving, as well as numerous national, provincial, and state records. The picture you see before you right now is the current women's world record, set in 2009 and still standing. It consisted of 181 women representing 31 different countries. I'm sure you can tell which one is me, right? Well, maybe that'll help. Skydiving's been an important part of my life. Many of my best friends are skydivers who I've known through many, many years. I actually met my husband skydiving. He showed up at the drop zone as a brand new student when I had about 200 jumps. At that time, he was 30, the oldest person on our drop zone. Things have certainly changed since then. Professionally, my expertise is in health risk communication. Now, I started my professional life as an environmental biologist. And as such, I spent many times in public meetings listening to people who were fearful and anxious about environmental risks that they felt posed a threat to their health and well-being and those of their families. I started to realize that while we did a good job on the science, the risk assessment part of things, we didn't do a very good job in understanding different perspectives or perceptions on risk. And we were certainly doing a horrible job at communicating about risk. As a result, it was very hard for us to make appropriate and meaningful and effective risk management decisions. I came through all of this to understand that risk is a word we use cavalierly, but really means different things to different people at different times and in different contexts. So why is this important? Well, maybe we should start with how we actually assess risk. Technical assessment of risk involves 3 simple components. The first is the hazard, the what can go wrong. The second is the probability. How likely is it to go wrong? And then finally we have the consequences. What happens if it goes wrong? This might be more understandable if we put it in the context of a risk we are all currently experiencing, the coronavirus. In this case, the risk is the coronavirus itself. Probabilities are a bit more complicated because we're worried not only on how likely we are to be exposed to the coronavirus and thereby acquire COVID-19, the disease that results from it, but we're also concerned about how likely we are to have the more severe symptoms associated with coronavirus as opposed to very mild or asymptomatic occurrences of it. And of course, the consequences of the disease are these symptoms themselves. So that's the technical assessment of risk, but there are other ways that we think of risk. There is the more familiar or colloquial way we talk about risk, where it's something dangerous or hazardous or perilous or threatening. But we also think of risk as an opportunity. Think about when you bought your last lottery ticket. You were perfectly willing to risk that $2 for the chance to get millions. There are also other types of good risks in our lives. For example, in the decisions that we make about getting married or starting a family. With the divorce rate in Canada currently at about 40%, this is not an unrisky activity, but we're willing to take that risk for the benefits of having a loving relationship. The third category of risk is the insurance category of risk. Now, the insurance industry has a very narrow view of what risk is. To them, risk is only chance or uncertainty. They're not really concerned about the consequences of your house burning down. They're just concerned about how likely that is to happen, and that they would therefore have to pay out your insurance benefits as a result. Perhaps the best way of understanding why these different meanings of risk and different perspectives of risk matters is through an example. There was an old joke in the insurance industry that concerned two skydivers. The joke was, if you had one parachutist leave a plane with a parachute on and the other one leave without a parachute, who's more at risk? Well, the answer might seem obvious to you, but from an insurance industry perspective, it is actually the skydiver with the parachute who is more at risk. There is much more uncertainty about what's going to happen to that skydiver, whether their parachute will open properly, whether they land safely, whereas there is almost no uncertainty associated with the fate of the skydiver without the parachute. However, for us, I think we would all feel far more at risk if we were the person without the parachute on, as the hazards to us personally, the risk to us personally, and the consequences to us personally would be much more dire. Now, this is a very black and white example, but I think it goes to illustrate why how we define risk and our perspectives on the risk and what that risk means to us are very important in how we make decisions around risk. There is in my field of study a very well-known and revered scholar named Dr. Paul Slovic, who I've actually been privileged to know for about the last 25 years. Paul made great contributions to our understanding about why the definition of risk matters in his paper, wonderfully titled Trust, Emotions, Sex, and Politics. In this, he said that whoever controls the definition of risk controls the rational solution to the problem at hand. If we are using a very analytical, political way of looking at risk, one solution may come to the fore. If we are looking at maybe a more emotional or a more people-centered view of risk, another solution comes forward. And because of that, whoever defines risk controls the power. Defining risk is an exercise in power. Paul wrote a subsequent paper that also helped us to understand this, called Risk as Analysis and Risk as Feelings. In this paper, he purports that there are two fundamental ways in which we determine risk in our lives. One is very analytical. It's the math, the logic, the models, the time-consuming processes that we use to produce evidence on risk. The second way that we define risk is through our emotions. It's through our experience. These are the gut feelings we all have about whether something is right or wrong, whether it's risky or it's safe. It's the feelings that help us decide whether to go into a dark street at night, if it's safe or not, or if we take a glass of water that smells funny, is this something that's safe to drink? We've always thought that the analytical definition of risk is the one that should control how we manage risk. But Paul actually showed us that there is good evidence to show that we need both of these perspectives on risk to make good decisions, that they have to be integrated in the decisions that we make. Maybe the best way to illustrate this is through more examples related to coronavirus. We've heard a lot in the last number of weeks about the concept of using herd immunity as a way to control the virus. Now, herd immunity is something that is illustrated in this diagram. We start with a novel virus, like the coronavirus, and people immediately get sick, all the orange hexagons there. As those people get well, they presumably have some immunity to the virus. Or if we get a vaccine, then we have people get immunity to the virus. But we don't have a vaccine yet for coronavirus, so we're relying on people getting sick. Eventually, we have enough people that have immunity that we're able to protect those people who haven't yet been exposed and who might be vulnerable. And at that point, we reach herd immunity and the virus dies out because it has nowhere else to go. Now, in a coldly analytical way of looking at risk, it seems to make sense that we would use herd immunity as a way to control it. It would mean no restrictions. It would mean no shutdowns. It would mean the economy could continue as usual. But let's just look at the math and what herd immunity would entail. Using these numbers, the 2019 population of Canada, a conservative estimate about the percentage of the population that would needed to be infected to get herd immunity. Scientists think it's somewhere between 55 and 82%, so we're taking 68%. And the average mortality rate around the world, you do the math, 870,000 people would have to die in Canada for us to achieve herd immunity. And this is even more scary if you look at those numbers for the United States, where over 7.5 million people would have to die before herd immunity could be achieved. So this is one case where the coldly analytical option is just unacceptable to us because our emotional reaction to risk, our sense of values, our sense of what is right and wrong says that we cannot allow that many people to die to achieve herd immunity and to get control of this virus, and there has to be a better way of doing it. Another example where analysis and emotions need to be thought of in context is this COVID fatigue that everyone's suffering right now. Now, it's a perfectly natural reaction to rebel against having to unnaturally stay at home and isolate ourselves, and I know many people long to get back to a more normal way of life. However, our analytical analysis of risk shows us that that is not going to help us achieve any kind of control over this virus. Then in addition to the risk that we are taking ourselves by cutting away from our perfectly good parachute there, we are also going to pose a risk to others if we are not isolating, if we're not wearing masks, if we're not doing things to prevent transmission of the disease. So this is a case where clearly the analysis has to trump the emotional part of our decision making. A final example is illustrated here. Now, analytically, we know that yes, young people are far less likely to become severely ill with the virus and to die, although that's not absolute. However, we also know that those young people then become vectors of the disease to other people who may be more medically vulnerable, older people, those with underlying conditions. So while analytically, it is correct to say, I'm young, I can get immune, nothing bad is going to happen to me. The emotional side of our risk analysis tells us that it's unacceptable to take that selfish decision and that we need to be protecting ourselves and preventing transmission for the greater good. So hopefully this illustrates why we need to look at different perspectives of risk and to try and understand those perspectives of risk. I think what it boils down to is that we need to answer two questions. What do we want to achieve, and what do we value? This integrates the emotional and the analytical components of how we assess risk. It is something we need to ask ourselves individually, and it's a conversation we need to have as a society. Now, because I'm a risk communication specialist, I think that we need to do this by talking to each other. I think communication, dialogue, meaningful conversations are going to be our most powerful tool in addressing the risks that we take on as a society. However, we have to remember that these conversations cannot be one-sided, that it's as important for us to listen to other people as it is to do all the talking. And that maybe the most important tool we have is to try to put ourselves in other people's shoes and to understand why they see things from their perspective. We may not agree with it, but at least if we can understand it better, it gives us the basis for starting these difficult conversations. So to bring it full circle, why do I skydive? Well, I meld the emotional and analytical components when I make my decisions about sports like skydiving. I think this cartoon sums it up best, why I skydive, but I also love it that the little feline skydiver has my name written on her helmet. I know the risks of skydiving, and I do my best to control the risks that I can. I jump a relatively large parachute. I land very conservatively. I try to be aware of what's going on around me. But for me, the risks that I can't control in skydiving are far outweighed by the thrill, joy I get from being able to actually fly, and I wouldn't trade that for anything in the world. So my decisions on risk are both emotional and analytical, and very conscientiously made. I'd like to leave you again with these two questions and a challenge. To maybe think about these two questions the next time you're presented with a personal risk or even a wider risk that, like the coronavirus we're all dealing with, and ask yourself, what do we want to achieve and what is it we value? And then I further challenge you to try and have this conversation with other people and to make it truly a societal conversation where we can come together on trying to do the things we want to achieve, but to make sure that they are guided by our sense of what is right and what is wrong. Thank you.